I'm Paul Rufo. I'm a pediatric gastroenterologist, and I work in the Center for Inflammatory Bowel Disease at Children's Hospital in Boston.
I'm William Joachim. My son is Dr. Joachim, and he is a Crohn's patient with Dr. Rufo.
Most of the children that we see with newly diagnosed inflammatory bowel disease are diagnosed in what we would say the second decade of life. So that would be between ages 10 and 20. The problem is that the dosing and the side effect profile may not at all be the same in adults and in growing and developing children.
Around 18 months, we figured out that Dr. was diagnosed with Crohn's, and we started a medical treatment. The medication he was on worked until he was about 8 years old. Treatment seemed to work really well for him, and shortly after, Dr. Rufo approached us with the possibility of doing a clinical trial.
Some patients ask me what a clinical trial looks like for a potential patient and what the sequence of events might be. First of all, it starts with a discussion.
I think there's a huge misconception out there of what IBD or Crohn's and colitis is, and I think that with these trials and with the Crohn's and Colitis Foundation, we can do that.
Inflammatory bowel disease, both Crohn's and ulcerative colitis, are very complex diseases, and they're very heterogeneous. They're not the same from patient to patient or from age to age. People are looking to get more information either about the disease or how patients are responding to their illness. It might require simply a blood sample while they're drawing blood for clinical care. It might require a urine or a stool sample. It might require them to fill out a questionnaire.
We asked many questions, and long story short, we were a little bit more comfortable after talking to the clinical trial coordinator, and they kind of coached us through the process. When we approached him, we just said this was an opportunity to help others and help you, maybe in the future, with some better medications or better ways of receiving medication to make you feel better in the future. He was perfectly fine. It didn't seem to affect him at all. He just kind of went with it. And when we first show up to the clinical trial, Dr. checks in with the receptionist, and we are usually pulled aside for the typical testing. And then from there, the clinical trial person would come in, and then they would set us up with the special medications. The only thing that was added was a clinical trial coordinator who made the process much easier than we could ever imagine. We had no concerns about being forced to stay in the clinical trial. We were under the impression if it wasn't working out that we could back out at any point.